also I would like to thank so much Professor Gardoza for her presentations. You made my life really easy. Talking about the value of good talk and communications between the pathologist and the radiologist. What I'm going to show in the next 20 minutes is what we need from you, what the pathologist needs from the radiologist. And Dr. Pahan, she asked me to give this talk, and I really think it's really very important because we share one optimum goal. We want to reach an accurate and quick diagnosis. So if you don't talk and if you don't understand each other, it will make it really difficult for us to reach this optimal goal. And I'm sure if you ask many pathologists, what do you need from the radiologist? They will obviously tell you we need a good core biopsies. We need a good biopsy so we can make an accurate diagnosis. But I want to go beyond that. I want to go beyond just getting a good core biopsy. What do we mean when we say that when the pathologist is telling you I need a good core biopsy? They need quality as well as also they need the number, and I'll talk about both of them. When we see this, for example, this is what we mean by good quality. This is a scanning image showing 3 cores of good quality. When we say good quality, it means they are not fragmented. It's showing the lesion, obviously for us, and for all pathologists, they will look at this area and will say, oh, there's a papillary lesions there. And there's something here I would like to go. And when you go to the high power, it's obvious for the many pathologists, when they see this area, this is diagnostic for us when we use our magic markers to know this is the invasive lobular carcinoma. And in fact, this was the case. Also, this is another example of really good quality course. It's an intact. This is 5 cores here. It's an intact course. We hate, by the way, fragmentations because it makes our life more difficult. So we would like to have a good representative course that are not fragmented. And this one is also, we can zoom in and we'll find, oh, there is a tumor there, and it's obviously an infiltrating carcinoma. This is also, when you talk about the good quality, we talk about the thickness of the core. Not just only the fragmentations, we like to have a really good thick core. And with the new techniques now available through the stereotactic coring biopsies, it's really easy to obtain a good quality with thick core. For example, majority of this core is fibrofatty tissue, but it shows also benign tissue here, and there's something here for many pathologists they would like to zoom in and go and examine. And yes, there's a tumor there. So that thick core, not fragmented, is really very helpful for us to make a definitive diagnosis. We also want to have the core to be really good representative of the lesion that you see on radiology. Like, for example, here you can see this lesion. This core is really good quality core, which obtained the area of interest for the radiologist. And you see there's something abnormal, and we can obviously see here this is really looks like a well-differentiated carcinoma, and we can zoom in and look at the high power. It really shows the tubular carcinoma, and we can use our magic markers to identify the lesion and differentiate them from adenosis. So if that was not obtained, and if the tissue is fragmented, we will not be able to make that definitive diagnosis.